I just want to pass on to Marius, Dr. Marius Gruber. He is a postdoc who has been visiting us from Germany for the past month or so. And actually 2 months, right? Yeah. So that's been great having him here, and he's going to be presenting some of his findings.
Yes, so hi everyone. I hope you can understand me well. So we are a little bit switching gears here because I will talk about these network mapping circuits in psychiatry, so more like neuroimaging without brain stimulation, but there are some connections to brain stimulation, and I think they are very interesting as well. Okay, so this does not work. Maybe. Yeah, this works. So first things first, this is my disclosure. I received remuneration from the company Janssen for scientific advisory, although this is not related to the present work. I would start with like basic neuroimaging findings in psychiatry, and I think we have to acknowledge that effect sizes in psychiatry, specifically for group differences, such as we see here for the group difference between healthy controls and MDD patients, they tend to be very small. So we cannot really use these effects or these between group differences as biomarkers for diagnostic purposes. We did this in a very large cohort of over 1,000 individuals where we compared healthy controls and MDD patients throughout a range of neuroimaging modalities, and in each of these modalities we tested for the largest possible effect we could think of or we could identify, and this is actually what we see. Those are the upper bound of effect sizes that we see, and on the other side we see this very large overlap. So yes, we cannot really use these group differences as biomarkers, for example, in the case of depression. And a potential reason for this might lie in the fact that these alterations, for example, in gray matter, but also functional activity, structural connectivity, whatever you can think of, they tend to be very heterogeneous. So we see here work done by Ashley Siegel and colleagues who show that in the case of depression, at most 7% of individuals show alterations within the same spot, so in the same brain region. And then obviously, if you calculate some kind of effect size, then you will end up with a very weak effect size. The same is actually true for alterations in functional activity in depression. So for example, hyper or hypoactivity compared to healthy controls and those with depression, it tends to be like scattered throughout the brain. This doesn't not converge on like one single brain region or whatever. So this is heterogeneous as well. And actually the same is true for causal brain lesions and treatment targets as well, right? So we can think of TMS and also DBS, which target different brain regions, at least like in the first perspective, or when you're looking at it like in superficial perspective. But still, so we have this kind of heterogeneity here. And this is where network mapping came into play. So here the idea is that we don't look at these like brain alterations in isolation, but rather we look at the circuits that connect them. We try to find circuits that connect all these different dots. And in the case of depression, this works actually quite well. That was what Robin was talking about. So this kind of converging circuit where both gray matter alterations, functional activity alterations, but also treatment targets, causal brain lesions, they all appear to converge on underlying circuits. They might be different circuits, but still they are correlated. It appears to be that all of them are converging on these circuits. And actually these circuits have been identified through network mapping analyses for other disorders as well, such as PTSD, psychosis, but a lot of other disorders right now. And I think that's very interesting, that's very exciting, but I also see a critical gap there because these circuits have been identified using normative connectomes from healthy controls. So basically the dots have been connected using this healthy control sample, for example, from the Human Connectome project. And so we don't really know whether these circuits are altered in depression or in other disorders. So for example, we don't know whether the depression circuit shows some alterations in those with depression. And so this was basically the aim of our project that I did throughout the last 2 months in Melbourne. And this is very much ongoing work. So yeah, there will be a lot of analyses both in the slides, but also coming up, I guess. So our main aim was to map identified circuits on structural and functional connectivity and do this in a large psychiatric cohort. and then identify deviations within these circuits and look at whether these deviations are linked to clinical measures. And for this, we took published circuits. So I think that's very important. We didn't look for like our own network mapping circuit. We took published circuits and mapped them to our data. More specifically, we took this depression circuit, the convergent depression circuit, but also an emotional processing circuit, a PTSD circuit, and a psychosis circuit, all of which have been published throughout the last years, and they have been published in very high-ranking journals. We focus on these 4 circuits because they are basically the ones we can investigate with our cohort data because they align with the cohorts we have in our data set. And what we did is we took these circuits, we transformed them. They have been published as, for example, NIfTY files. We transformed them into the free surface space and then parcellated them according to the parcellation we use for our connectome or structural connectivity analyses. So we end up with node-level circuit weights, which basically inform about like the implication of a given node into, for example, the depression circuit or the psychosis circuit or whatever you can think of. And we did so in a large cohort of over 2,000 individuals from the Marburg-Münster Affective Disorders Cohort Study. That is a large German study investigating the neurobiology of mental disorders. We had over 1,000 healthy controls and over 1,200 individuals with diagnoses such as depression, anxiety, bipolar disorder, schizophrenia. I want to point out that this is not a brain stimulation sample. That would be huge, and it would be great, but no, that's a cohort study, an observational cohort study. And so our analyses focus on 3 main questions. We wanted to find out whether these circuits are specific and especially whether they are specific with regard to the brain regions that are kind of part or participating in these circuits. We wanted to find out whether there's an alignment between group differences or deviations in connectivity on the one hand and these circuits, or put differently, do we see alterations inside these circuits that have been identified? And we wanted to find out whether we can use the connectivity inside these circuits for like a better classification. So does this increase the classification accuracies when we focus on these circuits that appear to be relevant to all these disorders? Coming to our first analysis, the question of whether we see like specific circuits, and this is what we see basically after mapping these circuits to our MRI data. We see, for example, in the upper left corner, the correlation between the circuit weights for the depression circuit and the PTSD circuit. And we see correlations of up to 0.7 or even higher. I should point out that some of these circuits or these correlations are negative, and this is due to kind of the polarity of the circuit, quite kind of the information that is contained in the circuit, whether it's about depression, whether it's about being able to emotional processing or whatever. Like, so this is basically the point here. But we do see these strong correlations, which basically tell us that there is an overlap that could either mean that there is a lack of diagnostic or spatial specificity, but it could also point toward a transdiagnostic pattern, right? We know that, for example, depression and PTSD overlap in their symptoms, so it's not impossible that their neurobiology, that there is also like an overlap in the neurobiology. But still, I think we should keep this in mind. Coming to our second analysis, so the question of whether we see alterations inside these circuits. And for this, we first took a group level approach. So basically what we did is, for each node in the connectome, we tested the difference between, for example, healthy controls and MDD patients and expressed this as a t-value that represents kind of the group level deviations and, for example, functional connectivity in a given node, in a given brain region of the connectome. And so this gives us basically a vector of t-values that express the deviation at each and every node in the connectome, and we can then just calculate the correlation with each and every circuit. And this is what we end up with. I think it's a huge figure, but we see in the upper left corner, for example, the t-values that represent the difference between healthy controls and MDD patients on the y-axis, and then the circuit weights for the depression circuit on the x-axis. And this, for example, this correlation is actually positive. This is exactly what we would expect, right? We would see an overlap between group-level deviations and the circuit. So, yeah, the circuit really conveys some alterations, and we also see some correlations for the other parts. However, if we apply a permutation test, then these associations, they are not higher than what we would expect based on the autocorrelation of the human brain. And also, if we then correct for all these different associations, because we did a lot of multiple comparisons, then none of them remain significant anymore. So yes, there is some kind of pattern, and there is some kind of signal that we see, but it's not more than what we would expect, especially concerning the effect size. It's not higher than what we've seen on the first slide regarding these group level deviations. We then took a more subject level approach because, yeah, I started the talk with saying that there is a lot of heterogeneity, so maybe don't take a group level approach. We took a subject level approach, and for this we calculated pattern expression scores, which basically inform us about the level of alignment between an individual's deviation and functional connectivity and a given circuit. And for this, we set up a normative model, which gives us basically the expected connectivity for each and every individual. We can then derive deviation scores, and we can calculate the correlation between deviation scores and circuit weights. And if a given individual would show a perfect alignment between nodal deviations and, for example, the depression circuit, then we would see a pattern expression score of 1. And we could think of a pattern that, for example, those with depression are more likely to exhibit deviations that align with the depression circuit or whatever. However, when we just look, like in the first step, to go back to this group level comparison, we don't see any clear pattern. It's not like depressed individuals show a level of deviation that would perfectly align with any of these circuits. Taking a more transdiagnostic perspective and relating this to clinical measures, and we really try to put in a lot of clinical measures like symptoms, but also cognitive functions, disease cause information, we see some correlations. They are not very high, but for example, we see a positive correlation between deviations in the depression circuit and depressive symptoms, so that's great. But again, if we correct for multiple comparisons, none of them remain significant anymore. So again, we see a pattern, but it's not very strong. The third analysis then focused on the question of whether we can use the connectivity inside these circuits to classify or to diagnose patients, and to do this in a better way than when we just take the mean connectivity or whatever. And for this, we just set up like a very simple model, a support vector classifier that took as the sole information on the sole feature the connectivity inside, for example, the depression circuit or the psychosis circuit. And we then try to differentiate, for example, between healthy controls and MDD patients. And so this is what we are working with. This is the connectivity inside each of these circuits differentiated between healthy controls and MDD patients. And I think you can already see there's not much going on. It's not much of a signal there. And yeah, this translates into very bad model performances. We end up with model performances at around 0.5 and also very small area under the curve. So we cannot use the connectivity, at least with this admittedly crude measure, we cannot use this connectivity or the connectivity inside these circuits to differentiate these diagnoses. And actually this was true for all the other comparisons as well. So for anxiety, for bipolar disorder, for schizophrenia, we don't get a very clear pattern here. So to summarize, I think this is one of the first investigations of the connectivity inside published circuits, and I think that's very important because we need to understand what's going on there. What's the difference that might be present in individuals with depression or psychosis or PTSD or whatever. Our analyses, they don't provide clear evidence for alterations inside these circuits. We see some signals, we see some alterations, but they tend to be not stronger than what we would expect based on what we know about alterations in the human brain and the connectivity. This is actually also true for structural connectivity, so I did all of these analyses for structural connectivity as well, and also different atlases. We also see this pattern in all these analyses. Our future analyses, because as I said, this is very much ongoing work, will also include other modalities. So we want to look at whether it's gray matter of the brain regions or functional activity rather than functional connectivity. Because it might very well be, and I think Robin, you pointed this out, it might be that it's not like the connectivity that is altered in these circuits, but rather properties of the brain regions that are participating in these in these circuits. So this is what we want to work with in the next steps. With this, I want to thank you for your attention. I want to point your attention now to these 4 circuits, because I think it's important that these authors, without them publishing their circuits, we wouldn't be able to investigate them. And I think that's very important from an open science perspective. If you want to see a lot of more analyses that I did, please visit me at my poster 1379. And also, if you want to discuss other structural connectivity analyses, I'm here tomorrow as well. With this, I want to thank you. My name is Marius Gruber. If you have any questions, please don't hesitate to ask.